Bismillahirrahmanirrahim. Rabbi zidni ilma. Discipline is the bridge between goals and accomplishment. Assalamu alaikum. My name is Dr. Sadia Rafiq, and today my topic of presentation is hepatitis A. Learning outlines include introduction to hepatitis A, epidemiological determinants, chain of transmission, clinical features, levels of preventions, and recent advances. Learning outcome. At the end of the presentation, you should be able to describe the epidemiological triad and prevention aspects of this infection, understand the factors that contribute to its spread, and knowledge of recent advances. What is hepatitis A? Hepatitis A is highly contagious viral liver infection, preventable by vaccine and caused by injection of fecal matter. It might last for weeks up to months. Symptoms include jaundice, nausea, and abdominal pain, and spread is by direct contact, infected food, and sewage contamination. Introduction. Hepatitis A virus is a 27 nanometer RNA member of picornavirus family that causes epidemics or sporadic cases of hepatitis. It has a single-stranded RNA genome that replicates in the cytoplasm of the cell. It is also known as enterovirus 72 and has one serotype. Problem statement. Worldwide, approximately 1.5 million reported clinical cases of hepatitis A. The rate of infection is probably as much as 10 times higher. It is strongly indicated to socioeconomic indicators, access to safe drinking water, and standards of hygiene and sanitation. Areas of the world can be characterized as having high, intermediate, and low endemicity for hepatitis A. Areas of high endemicity includes most of Africa, Asia, and Central and South America, including China, Pakistan, India, Nepal, and Bangladesh. Moderate endemicity countries include Korea, Indonesia, Thailand, Sri Lanka, and Malaysia. In less developed countries with high poor sanitary, household crowding, and hygienic conditions, hepatitis A virus infection is highly endemic, and most persons get infected in early childhood. Course of disease. Generally, it is self-limited, usually less than 2 months. Relapsing or prolonged hepatitis A virus up to 6 months occur in 10 to 15% of symptomatic infections. Case fatality rate increases with age, 1.8% for persons more than 50 years of age compared to 0.6% for persons less than 50 years of age. Persons with chronic liver disease are at increased risk for development of fulminant hepatitis A. World Hepatitis Day is being celebrated on 28 July. Epidemiological determinants include agent factors, host factors, environmental and social factors, incubation period, and mode of transmission. Agent. Hepatitis A virus is an enterovirus of picornaviridae. It multiplies only in hepatocytes. Fecal shedding of the virus is at its highest during the later part of the incubation period and early acute phase of illness. Age. Host. More frequent among children than in adults, but all ages are susceptible. Both sexes are equally susceptible. Immunity after attack probably lasts for life. Environment. The cases of hepatitis A virus infection occur throughout the year, closely related with poor sanitation, overcrowding, and contaminated food. Reservoir of infection. Humans cases are only reservoir of infections. Cases range from asymptomatic infections to severe ones. Asymptomatic infections are especially common in children. No evidence of chronic carrier state. Source. Mainly man's feces, blood, serum, and other fluids are infecting during the brief stage of viremia. Hepatitis A virus is excreted in the feces for about 2 weeks before the onset of jaundice and for up to 1 week thereafter. Incubation period is 15 to 14 days, most of the time 25 to 30 days. The length of incubation period is proportional to the dose of the virus ingested. Period of infectivity. The risk is greatest from 2 weeks before to 1 week after the onset of jaundice. Infectivity falls rapidly with the onset of jaundice. Mode of transmission. Fecal-oral route, major route of transmission with the contaminated food and water. It is direct from person to person. Indirect includes contaminated water, food, and milk. Parental route is very rare, but it occurs at the stage of viremia. Sexual transmission, mainly among homosexual men. Symptoms include fever, fatigue, nausea, loss of appetite, jaundice, stomach pain, vomiting, dark urine, pale stools, and diarrhea. Pathogenesis. Hepatitis A enters into the mouth, viral replication in the liver, virus present in blood and feces 10 to 12 days after infection. Virus excretion may continue for up to 3 weeks after onset of symptoms. Clinical findings. Patients with hepatitis A virus infection develop acute hepatitis. They do not develop chronic hepatitis, chronic carrier state, cirrhosis, and hepatocellular carcinoma. Pre-icteric or prodromal phase. This phase precedes the onset of jaundice by 1 to 2 weeks. Onset may be abrupt or insidious. Clinical illness is more severe in adults than in children. The patient may have mild flu-like symptoms of headache, fatigue, malaise, low-grade fever, anorexia, nausea, and vomiting. Icteric phase. This is characterized by the presence of jaundice in 70 to 85% of adults with acute hepatitis A virus infection, bilirubinemia, hepatomegaly, and splenomegaly, abdominal pain, rash, and enlarged lymph nodes. Then comes the convalescent phase. This phase lasts for 3 to 6 weeks. Symptoms last less than 2 months, as long as 9 months. About 15% of people infected with hepatitis A virus symptoms that come and go for 6 to 9 months. Diagnosis. The diagnosis of acute hepatitis A virus is based on serological testing for IgM and IgG anti-hepatitis A virus. Weak titers of IgM anti-HAV occurs during the first week of clinical disease and disappear within 3 to 6 months. Detection of IgM anti-HAV is an excellent test for diagnosing acute hepatitis A. Titers of IgG anti-HAV rise after 1 month of the disease and may persist for years. IgG anti-HAV indicates previous exposure to hepatitis A virus, non-infectivity, and immunity. And there is also in the initial stage elevated transaminases, AST and ALT. And you can see this in the graph. Initially, ALT increases, the IgM peak comes and goes down, and then the total anti-HAV bodies form. They remain almost throughout the life. Treatment. No specific treatment for hepatitis A, usually symptomatic and supportive. Recovery may be slow and may take several weeks or months. Therapy is aimed at maintaining comfort and adequate nutritional balance, including replacement of fluids that are lost from vomiting and diarrhea. Levels of prevention, primary, secondary, and tertiary. Primary prevention includes health promotion and specific protection. Health promotion includes hepatitis A awareness programs, stop the spread of hepatitis A by washing your hands and get vaccinated. These all measures prevent hepatitis A, which includes vaccine, wash your fruits and vegetables, cook the food properly, have drugs if you get the hepatitis A infection, then clean your dishes, cut nails short, wash your hands, clean drinking water. Specific protection. Vaccination. The best way to prevent hepatitis A is through vaccination with the hepatitis A vaccine. Hepatitis A is one of the few food-borne illnesses that can be prevented through vaccination. Active immunization is available. 2 doses, initial dose followed by booster at 6 to 12 months are given. First dose is given after 12 months. The vaccine is recommended for persons living in or traveling to endemic areas, including military personnel, patients with chronic liver disease upon diagnosis, persons with clotting factor disorders, homosexuals, animal handlers, illicit drug users, sewage workers, food handlers, children and caregivers in daycare centers and institutions. Secondary prevention. Secondary prevention of spread by the rapid investigation of close contact to ensure their proper treatment. Prevention and containment. Control of reservoir. Control of reservoir is difficult because of the following factors. Fecal shedding of virus is at its height during the incubation period and early phase of illness. Occurrence of large number of subclinical cases, absence of specific treatment, low socioeconomic profile of the population usually involved. Then the control of the transmission. Best mean of reducing spread by promoting simple measures of personal and community hygiene, hand wash before and after toilet use, the sanitary disposal of excreta, filtration and adequate chlorination, water treatment and distribution system should be improved. Then comes the control of susceptible population. Number one, immunoglobulins to induce passive immunity, particularly to those who are traveling to highly endemic areas. Close personal contacts of the patients within 1 to 2 weeks of exposure prevents illness in 80 to 90% of exposed. And then vaccine. This is the WHO hepatitis A surveillance standards. The objectives of this surveillance are to detect outbreaks of viral hepatitis, to monitor trends in incidence and identify risk factors for new incident infections locally and national level, to provide data to inform vaccine introduction. CDC has this hepatitis A awareness column, and they have the site of whole hepatitis A, in which it is they have mentioned and they've been stressed on it that hepatitis A is a vaccine preventable liver infection caused by the hepatitis A virus. In this, they have told us, they have mentioned that the vaccine is the best preventive measures in case of hepatitis A infection. So they have stressed it and gave us the schedule for the hepatitis A vaccination. The minimum age for this is 12 months for routine vaccination. 2 dose in series, minimum interval 6 months, beginning at the age of 12 months. Then there is a schedule for the catch-up vaccination. Unvaccinated persons through 18 years should complete a 2 dose series. Minimum interval is of 6 months. Person who previously received 1 dose at age 12 months or older should receive second dose at least 6 months after dose 1. Adolescent 18 years and older may receive the combined hepatitis A and hepatitis B vaccine, Twinrix, as a 3 dose series, 0, 1, and 6 months, a 4 dose series at 0, 7, 21 to 30 days, followed by a dose at 12 months. Then there is for guidelines for the international travel. Person traveling to or working in countries with high and intermediate endemic hepatitis A, infants which are from the age of 6 to 11 months, 1 dose before departure, revaccinate with second 2 doses, separated by at least 6 months interval between 12 and 23rd month of the age. And unvaccinated age 12 months and older, administer dose 1 as soon as travel is considered. Then there are CDC guidelines and recommendations of the hepatitis A, and it includes regarding immunization practices, guidelines regarding international travel, and guidelines regarding the close contacts. Then there is a hepatitis A widespread person-to-person outbreak across the United States. In this, they have mentioned that many people think about contaminated water and food. However, in United States, hepatitis is more commonly spread from person to person. So there is a direct contact spread in US. Since March 2017, CDC's Division of Viral Hepatitis has been assisting multiple states and local health departments with hepatitis A outbreaks spread through person to person contact. So in US, the contaminated water, food, and sewage systems are not the problem for the spread of hepatitis A, rather than its direct contact. So the hepatitis A vaccine is the best way to prevent hepatitis A viral infection. And the vaccination during the COVID-19 pandemic, the risk from person to person transmission of hepatitis A virus continues during the COVID-19 pandemic. The hepatitis A vaccine is the best way to prevent infection. People at risk for acquiring hepatitis A infection or developing serious complication from hepatitis A viral infection during the current hepatitis A outbreak should be prioritize to receive the hepatitis A vaccine as soon as it is possible to do safely. So during this pandemic, there are still outbreaks of the hepatitis A. Then it is one of the column in published viral hepatitis in Pakistan, in which they said in Pakistan, poor sanitary conditions and lack of hygienic practices lead to 90% of children being infected with hepatitis A before reaching 10 years of age. Hepatitis A virus accounts for 50 to 60% of cases of acute viral hepatitis in the pediatric population of Pakistan. Moreover, up to 100% of children tested positive for IgV, IgG by 14 years of age, indicating that most people are exposed to the disease during childhood, again as compared to children. 5.4 to 6.1% of adults have been found to have acute hepatitis due to hepatitis A virus. Despite measures taken to control viral hepatitis in Pakistan, there is a lot more to do. The burden of hepatitis A and E will not reduce unless basic facilities, including safe water supply and better sanitary conditions, would be available across the country. There is a need to establish a central registry for outbreaks, mortality related to hepatitis and liver diseases, and surveillance system for viral hepatitis needs expansion. These are the references of my books. Then now it's a time for the multiple choice questions. Number 1, mode of transmission of hepatitis A is blood transfusion, sexual transfusion, use of syringes, sewage contamination of food, vector-borne transmission.
D.
D. D.
D.
Yes. In case of infection of hepatitis A virus, percentage of patients showing sign and symptoms are 1%, 2%, 10%, 15%, or 20%.
It's E.
20%.
20%.
20%.
Yes, it's 20%. Which of the following statements is not true regarding hepatitis A? Incubation period is 5 days. Maximum infectivity is 2 weeks before to 1 week after diagnosis. Chronic carriers are responsible for
C.
large.
C.
C. C.
C.
C.
C.
Question 4. Which of the following statement is not correct in relation to hepatitis vaccine? Is formally inactivated vaccine?
D.
No.
C.
D.
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 Cannot be given to older children.
Yes. You have a friend who's going to China for 7 months. He has previously hepatitis A virus. Then today, so far, you are telling A, dose of
D.
vaccine,
A.
The dose
A.
of
A,
hepatitis A virus.
Delta.
no,
A. It's
A.
A.
We will only vaccinate with the first dose of hepatitis A vaccine. If you are infected with hepatitis A virus, the most likely because it is within few hours, within 1 week, within 7 weeks, within 1 year.
C.
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 Clinical disease hepatitis A infection results in sudden onset of diarrhea, fever, tiredness, loss of appetite and nausea,
C.
jaundice, diarrhea.
D.
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 It's B. Fever,
D.
tiredness, loss of appetite and nausea. The diagnosis of hepatitis A virus in Pakistan varies based on severity of and transmission level.
D.
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 D. D.
D.
D.
Which of the following group of people are not eligible people traveling to men having silent
Babies. D. Babies all. Babies born to mother.
yes, it's D.
D.
A 32-year-old have infection with hepatitis A virus. In a blood sample, IgM antibodies detection confirm the HIV infection, how long after the initial found in the blood? 4 hours.
1 to 2 weeks.
C.
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 This is the. Thank you so much.
Thank you very much. Please announce the result of the study, and I request all participants to smile.
Ma'am,
Please, all participants, please mute your mic, and Dr. Sadia, please announce the results. And this is a wonderful presentation, and I would have little comments, little bit of comments, sorry, and then we would discuss it in detail. Right.
yes,
So,
ma'am.
Dr. Sadia, please announce the results.
Ma'am, Dr. Rabia, Dr. Maida, Dr. Naila, Dr. Khansa, and Dr. Mehri, all were turning at the same pace.
Very nice. Well done. This shows how much everyone is interested and how they are putting their hard work and efforts in it. I'm so glad. Well done. Now, what about the subclinical cases?
Yes, ma'am.
Dr. Sadia, my question is about the subclinical cases. How you would define the disease burden on the basis of subclinical cases? As we know that hepatitis A has a lot of disease burden, especially because the subclinical cases are more. And the subclinical cases, as we discussed, is like a tip of an iceberg. There is very large number of the cases that are subclinical, and what we are looking at the sentinel sites or clinical cases, it is just the tip of an iceberg. So please comment on that.
Ma'am, I have told you that humans are the reservoirs. In reservoirs, we have the cases and the carriers. Cases we can be clinical, subclinical, and they could be latent. In subclinical cases, they have the infection, they are getting, but they are not showing the symptoms basically, and they are shedding and spreading the virus. As I have told you, before the start of the jaundice, 2 weeks before and 1 week after is the maximum infectivity period for the shedding of the virus. But if the patient has a long period, long incubation period, this infectivity period automatically increases. And it also it directly proportional to the dose of the virus inside the on the level of the viremia. So we have seen that the total period which have been shown of hepatitis where virus infection extends up to 6 to 9 months. So as in the asymptomatic patients, the infectivity period is also increased. And there are major concern that at the age of 14, as it was shown in the article, almost all of the children have the almost 100% IgM in the IgG antibodies they have. It means they all have been exposed. There may be cases, they may be the carrier subclinical cases as well, because they were spreading maybe this can be said that the subclinical cases are usually taking so much part in the spread of disease, and because they are undiagnosed, untreated, but still they are spreading the disease.
Okay. Would you please relate it with clinical history and the natural history of the disease?
Clinical history. And the patient having the clinical symptoms, if he has hepatitis A infection, usually it's flu-like symptoms. As we have said, it's malaise, fever, nausea, vomiting, abdominal pain, and in diarrhea. These are the clinical symptoms of the patient. And at this phase, the patient starts from the flu-like symptoms, and he is or she is shedding the virus through feces continuously, and he may be contaminating the other family close contacts are exposed to that person all the time. So at that phase, and if the incubation period is prolonged, then the person would be infected, but he would not be spreading that much. As the symptoms appear, the infectivity increases. At that stage, when the virus is in incubation period, the person is infected as well, but is not getting the symptoms, because the virus replicates in the hepatocytes. It's multiplying over there.
Okay, right. The natural history is more important than the clinical history of this disease. As far as hepatitis A is concerned, we know that there is a natural history. Usually, the people who get symptomatic and they have the clinical presentation, they subside after a certain time, even if the treatment is not being offered. And if good dietary management and rest and all other important things has to be taken care of. I want to add one important thing that has been missed in this presentation is about the smoking. Usually people, they have the aversion to smoking. Moreover, it has been found that smoking has a hazardous effect if it is continued. So the most important point here is that the smoking has to be stopped. And if that patient has a very good diet, rest, and stop smoking, alcohol intake, and other things, there are a large number of the patients who recovered with their natural immunity in place. The natural history is so important that it has been used by the quacks and different people to cure hepatitis. Perhaps you have seen the necklace in many patients' neck. That necklace that is hanging in the in patient's neck. It is basically, what is this? Anybody has any idea from the class?
Yes, ma'am, we have seen in our.
किसी ने देखा है कभी वो necklace?
Ma'am, yes,
जी.
ma'am. I have seen that necklace. They have said that the doctor has given us some piece sort of with dam darud that your yellow discoloration of eyes and this will subside with the time. Yes, they have. I have seen that. Yes,
Very nice.
we have
This
six as
is
well.
the how they have captured the natural history of the disease, and they have related this with the wilting of the leaves that are present in that necklace, and this wilting of the leaves that would lead to the disappearance of jaundice, or there is a icterus-free phase, and that phase relates when the necklace touches their umbilicus. You would be surprised by the measurements that has been done for that necklace. It has many turns, and in each turn there is a leaf that is put in, and these leaves, they are wilted with certain time, like 3 days or 4 days, and in 2 weeks that necklace usually reaches their umbilicus. So these all are those things that have been related with the natural history. So these are, as Dr. Sadia has correctly said, that necklace, when it is hanging in the neck, later on it goes on increasing and increasing in length. And one day that length touches the umbilicus of the patient, and that day would be the day when the jaundice starts fading away or even completely gone, and the icterus-free state that sets in. So how they are doing it? They are actually using the natural history of the disease. As we all know that after the onset of the clinical features, especially jaundice, fatigue, malaise, loss of appetite, etc., the patient usually have 2 to 3 weeks where he would have the recovery or convalescent phase, and that phase is very important, because if all important precautions has been done, preventive measures has been given to the patient, they usually become better. So they used that phase with the wilting of the leaves and lengthening of the necklace and giving a hope to the patient that they are going well. So this psychological effect also improves the patient's well-being, and they feel much better. And after 2 or 3 weeks, they are in their convalescent phase, but they are feeling much better. So this is how the natural history of the disease has been related with the clinical history of the disease. As Dr. Satia has wonderfully explained about the subclinical cases, so I would not go into detail. But the most important point in hepatitis A is that the subclinical cases are even more than we are having them at any clinical reference point. How these subclinical cases should be identified? Our challenge is basically giving the screening programs in all those areas where there is still a very high disease burden and where immunization programs that are deficient. So with all these comments, I am thankful to everyone. And if you have any questions, you can ask. Okay, thank you very much. Well done, everybody.
Thank you,
See
ma'am.
you tomorrow, inshallah. Allah Hafiz.
Thank you, ma'am.